Aloha, everybody. All these YouTube people are always saying things like, hey guys, and I always laugh at them and mock them. But here I go. I almost said, hey guys, at the same time. So I'm saying aloha, guys, which nobody else on YouTube says. But I want to start off by saying that to all of you. So aloha and welcome. My name is Ka'ala Souza, and we're doing a live stream today, which is like back in the day. We're doing a lot of these a few months ago, took off a little bit, and now because we have very interesting people on the line, I want to get this going. And not only that, but today's October 4th, it is National Digital Inclusion Week. So we got to get on this thing and start talking about people being included. Somebody asked me what digital inclusion means to me. And I'm like, it's kind of like when you were a little kid and you were picked or not picked to play on the kickball team. I remember that kind of throwing me back to those kind of traumatic times. Like nobody wanted me. You just not included. And for us right now, when we start talking about digital inclusion, if you don't have the skills, you don't have the computer, if you don't have the internet connection or the digital devices, those kind of things, you just can't compete, you can't play, you can't participate in any of the activities that are so much a part of what we're looking at here. And so today we're talking about challenges and solutions in rural healthcare. It is the kickoff October 4th for Digital Inclusion Week, and I gave a shout out and call out to somebody I've been working with over the last couple of months doing some digital including things. And her name is Dr. Kelley Withy. And I told her, hey, can you jump on this live stream with us on Monday, October 4th at 12 o'clock? And can you jump on? She's like, yes. And so as we were talking just before we started, she's like, what are we doing again? I said, we're talking about digital inclusion and all the things that she does. And so really it is a talk story with Dr. Kelley Withy. I wish I had my applause thing going on. Kelley, thank you so much for joining us. I'm clapping.
My pleasure.
I know you didn't know what was going on. You just showed up, and what are we talking about again? And
Yeah, I can talk about most anything, but I
yes,
yes,
I know you
I,
were talking about Princess phones. Tell me a little bit about that right before you get started. We're talking about, do you
oh,
remember the Princess phone?
yeah. I said I'm so old. I remember waiting at home for calls to come to me on my Princess phone, which is
Oh,
a old style phone.
yeah. Thanks for trying to define that. Like, I'm trying to share this with my kids. Like, it's like there's a box and there's numbers on it, and they're like, what? So it's just. But we're also talking about. You were talking about, like, I remember when the first computer came in. Do you remember what the first computer was that you saw?
Yes, I think I saw IBMs that had those floppy disks that you
Oh yeah.
put in them. But I was really lucky because I had one of the first computers in college, and it was a Macintosh, Apple Macintosh, and it had 128K memory. That was it, K, not just K.
That's right. Oh, that's so classic. I remember my high school had a lot of computers, and I was always impressed with that. We had I don't know, 10 computers in our library, and they were all Apple IIe's or Apple IIc's or something. And I learned 10 go to, no, 20 go to 10 something, some kind of, I wish I would have paid attention. I wish I would have paid attention. But so good to have you on here. I mentioned earlier in my introduction that we have been working together doing some training actually in rural areas, and that has been so fascinating for me to watch the things that you are doing there, and I want to share some of that with other people. But before we do, can you just give me a little backstory because I really don't even know. This is kind of, I told you, this is like a public like my public effort to try and figure out what exactly are all of the things that you do. So I know you're a doctor, but that's all I know that you're super cool. I know that you give computers out, you do telehealth training, but then I'm trying to find, like, if I Google you, there's so many things. So how do you explain yourself? Who are you?
Okay, so first of all, I have to apologize. My dog is old and sick, and so I'm going to try and get my son to come get him while he's
That's
coughing
okay.
here.
That's
Um,
okay. I like
so
having a dog
I'm
there
a
though. So
family.
full disclosure, dogs are always welcome.
Yes, he's a good 14-year-old dog. He's been a great dog to us, and now he's anyway. So I'm a family physician, which basically means I do everything. And I work at John A. Burns School of Medicine, University of Hawaii. And I worked there 25 years, but for the last 20 years, I've wanted to get more services out to rural areas. So my personal goal is to make sure everybody in Hawaii has access to the care they need, where they need it, when they need it. So that's a big challenge, and it's a huge challenge actually. And so 20 years ago, I started out, and I loved telehealth then, but of course, there wasn't really much access to it. Um, so, in the meantime, I wrote grants to get medical students to rural areas, and that takes money. Here, they gotta fly, they gotta stay somewhere, they've got to. Oh, that was good. He farted at the same time as he
Jeez.
coughed.
This is hashtag keep it very real live streams. This is how we do. I mean, can you imagine if we came over to your house, we're like, hey, this, and we'd probably be having some food or something because it is right around lunchtime. But we would
Yep.
eat, and your dog would do his thing, both things, both the breathing and the flatulating.
He scared himself away, so now he's walking away. So that's
Okay.
good. So anyway, the the thing you realize about Hawaii when you've been here a little while is we don't have enough doctors. But nobody knew in the 2007 time when I started the doctor shortage analysis. Nobody could tell me how many doctors we did not have or we did have. So I was trying to get medical students out to rural areas to practice, well, to do their training and then to go back to practice. So that was the idea. So I wrote some grants to do that. But that in itself is not enough. So then we expanded that. Can we do training in these areas for other people? Can we bring people over? I mean, it's a hassle if you are ill on a neighbor island and you cannot find the care you need. You have to take a helicopter or an airplane. You can't drive, of course. So what do we do? So we can train more doctors. We can assess the doctor shortage, which now is about 800 physicians less than what we would have if we
Wow.
were a community on the mainland or the
Wow.
continent. Yeah. So we have a significant physician shortage, and we also have shortages of all other providers. We're in trouble. So I do some work also with the Hawaii State Rural Health Association, and we wrote a grant for mental health and substance use and helping to find treatment for people in rural areas. Well, that's really hard to do, of course, but one way to do it is telehealth. Now, our doctors are so busy, they don't have much time to do telehealth. And so some of them do it on their weekends, but we're just thankful for when they do it because they're folks who can't get care. Let's say you're on Lanai and you need a child psychiatrist. How are you going to get that service on a regular basis? Let's say you're in Puna and you want treatment for substance use. What are you going to do? I mean, you'd have to go to Hilo, which is closer than some people, but you don't really want to do that. You don't want to tell everybody what you're doing.
Right.
So, can we help with telehealth? Well, yes, hopefully.
That's the
But
solution. That's the solution to this problem.
well, it's one solution. We need more doctors. We need more nurses. We need more everything. We need to pay better in the rural areas.
Wait,
But what?
no, I'm just gonna say, I would say, why don't we have enough doctors or nurses? What is the holdup here? What's the problem? I know this is the whole different
Well,
thing there, but I'm just curious.
okay, so we have the highest cost of living and one of the lowest pays in the country. So you've got to
Okay.
love it here to
Yep.
be a doctor here.
I can
You've
see
got
that
to
as a fact.
love living. Yeah.
Yeah.
So it's hard to convince people who aren't from here to come here. So we got to train more of our own.
Gotcha. Who are already here, who hopefully already love being here and would love staying here.
Right. That means we have to train more kids than we're training right now
Mm.
because we're only training 77 at UH, 10 at Waianae. We've got a PA school, we've got nurse practitioner schools, doctorate of nursing practice, but we don't have enough. We've got to train more.
Yeah.
Only way we can train more doctors is train them on neighbor islands. Oahu's full up. So we want to find training opportunities on neighbor islands.
And
anyway,
that sounds like there should be, but you're right. Go on. Anyway, thank you. Go ahead.
Yeah, that takes money. We're working on it.
Okay.
So, but for right now, what can we do? We can do telehealth. If we have a doctor who is available to do telehealth, we have connectivity, we have a device, and the patient knows how to use it. So those are three big ifs. So you said when I go out, I give out computers, but I know you give out more computers than I do.
Well,
so I really appreciate
it. Yours are the newest ones.
No, they're just refurbished Dells, but
right.
And from Hawaiian Hope, which we love working with Hawaiian Hope because they give us inexpensive computers. They sell us inexpensive computers. So if we give you a device, do you have internet? Now, I would say the biggest question for digital equity is just that, because we go to Molokai, we train people, we give them computers, but they could go home and it doesn't work.
Right.
And I'll just give you an example. All right. So last month when I was there, you were there too. I sat down and I tried all the digital speed screeners. Okay. So I brought with me, people told me Verizon was the best. So I brought a Verizon hotspot. Guess what the download speed was on that?
Where were you? Tell me. You're right.
So I was in the community center. I forgot what it's called.
You're just by the high school, is that right?
Well, where were we? We were teaching. Where were we?
The community center where Pastor Cameron has church. You said church. I don't know if
yeah, exactly. That one.
Okay,
it's like
so
Keahala or something. Keahala, Keahea. Yeah.
I don't know.
Okay.
Yeah, somewhere.
Okay. Verizon hotspot. 0.33 megabytes.
I can't even do that kind of math. 0.33. That's down, right? You're getting megabits per second down. Yeah.
Yeah.
Oh my
goodness. We had a Viasat donate a satellite, put it on the roof. We had 70 megabytes.
Okay, that's not bad. That's not
okay,
bad.
They're also hardwired in on I think it's Verizon. Their internet wireless was 100.
Okay.
That's great. Okay.
Yeah.
So I don't like really to talk about white privilege, but I came home and I realized my white privilege because my internet speed, I had to check it at home, right? 330.
Yeah.
So we went from 0.33 to 330. That is not digital equity. That is the definition of digital inequity.
Oh my goodness. Yes.
Yeah.
Don't now you're getting me started here. You're gonna trigger me on this because
Ooh.
I was going to the kupuna housing in Waimanalo, and they're beautiful setup over there, right across from the beach. You see the ocean, you see the mountains, but they have like the worst internet connection I've seen. Well, except for now you win. You're actually first place right now with this 0.33 megabits per second down. You're winning, but they were getting 15. I was going to everybody's house installing computers and connecting computers basically. But they're getting 15 megabits per second down, and it was like every Hawaiian homestead is like that. And I don't know. So if there's somebody who knows somebody who understands how the connection speed on Hawaiian homestead, land works, and please, holler at me and we'll put you on this thing too. But it is the worst. Well, second worst speed because yours is the worst that you got over there. What was that with Verizon? Is that what you said, or was it AT&T?
The hotspot was, let me see. Yeah, I think the hotspot was. Wait, Verizon doesn't make hotspots. Let me think here. So I took an AT&T one the first week, but that didn't work. They said no, that's no good. So you should come back with a Verizon one. So I went down to Verizon and I bought one. Yeah. Anyway, it was not good. So how do we get? So I guess on Hawaiian homelands, there's one provider that
Uh-huh.
will provide service. But if they didn't have enough cable, you can go with it's open up to you. So,
Okay. We'll see.
yeah,
Okay.
yeah. Okay.
I'm complaining right now, and I'm trying to be nice, and but it's a hard thing to watch. Like we're talking about people who've never had a computer before, and I remember asking one guy, I said, Uncle, what do you want this computer for? He's like, Oh, I want to see my grandchildren. They're on Hawaii Island. And by the time I see them, they're going to be adults already. I haven't seen them because it's lockdown. And I said, hey, have you know how to use computers? Have you used them before? He's like, never, never. And then when they get on and they see this little spinning balls of things, they don't understand why this is taking so long to connect. And they're like, well, this was the cool thing that you're trying to set up, Kala. Sorry, my bad. My
Yep.
bad. So
The
how long
spinning wheel.
when did you start doing these, going out into these communities and doing this? Because I mean I first heard about what you're doing a couple months ago, but how long have you been doing this? Where have you been going?
So we have started recently too. So we started a telehealth network, and we realized that if people don't know how to connect, they're not going to connect. If they don't have internet, they're not going to connect. And if they don't have a device, they're not going to connect. So probably about, well, I don't know when you started giving out your computers, but I love it. And I said, we got to give out computers. We got to help people
Oh,
with
nice,
their connectivity, right?
nice, nice, nice.
So we got to get them a computer, we
Mhm.
got to get them internet, and we got to teach them how.
Yeah,
So that's when we met. We were talking about the teach them how. And I got to say, I love what you're teaching them because it just, we follow so nicely because for telehealth, you usually need an email,
hmm,
right? You
yeah,
teach people how to get an email,
hmm,
and we teach them how to get online. You teach them how to get online. You teach them what a browser is. You teach them all that stuff,
hmm,
and you teach them about NBA or whatever, But uh, but then we teach them how to go on a website for telehealth,
yeah.
and they do it, and they have to get a confirmatory. It's kind of like the Hawaii Safe Travels program. You got to get
Hmm,
a confirmatory code
hmm,
to their email, and then they have to put it in. So then they, so you've taught them all that. You've gotten them an email,
hmm.
and then we just have to show them where the website is, and
Yeah.
it's beautiful. So it's
I
a good combo.
Yeah, I super, and I've been suggesting to people that if as much as possible, people that we combine those kind of things. Like, if you don't know how to use a computer, you generally don't use telehealth. And so, if you're signing up for a
Right,
basic computer class, you're gonna need telehealth support as well. If you're signing up for a basic class, you need a computer. If you're signing up for a basic class, you don't know what the emergency broadband benefit is. There's
right.
all of it just works. It connects together. It's kind of a sad negative spiral thing of things you don't have. And so now we're back to digital equity, where we have access. I think Bert Lum, the Digital Equity Declaration: access, literacy, and livelihood. Digital equity for all, ALL. So you were giving computers away, and I got like 30 from the Council for Native Hawaiian Advancement, and they just said, here's some computers, give them away. You're doing these classes. What else? What do you need? You want to you want me to pay for them, or do I have to sign something? They're like, fill out this thing here with this little form for membership. But then they said, send us pictures. That's all. And I just love giving people computers. Now, granted, it is older MacBooks. Yours is much newer. I think what are you running? Windows 10 on those computers? I think so, yeah.
I think so, yeah. So we had some that were 8 gigabytes and some 16. Curtis at Hawaiian Hope put them together for us, and they're refurbished, and they're only $150, and they're beautiful.
Yeah, no.
I
Hey,
love
shout
them.
out to Curtis and Lisa over at Hawaiian Hope. They have this
Yeah,
great system. I think they're one of the very few, if not the only one or two companies that are refurbishing computers here in Hawaii, in state. So,
yeah. And what's exciting is I just got the medical school to agree to give them all the
what?
e-waste. Yeah, so I'm,
Yes.
I'm super psyched because
Nice.
if we all gave Curtis our e-waste,
Mm-hmm.
he could do something with it.
Oh
Because
yeah.
I can't do nothing with it. I don't know what to do with e-waste. But I got a little tablet here that they gave me when I signed up for some phone. I don't know what
Yeah.
to do. I'm gonna give
Yeah.
it to him.
Oh my
He's
goodness.
gonna make some use of it. Yeah.
I've
So
never heard
any
of
company
e-waste.
that can give their e-waste, you never heard of e-waste? Oh my
I'm
gosh.
sorry. I feel a little awkward even talking about it. Like, Kelly, how's your
No,
e-waste? What's going on?
what do you do with your computer when it breaks, Kala?
Right now, they're all stored in my house. They're all right here.
Oh,
I'm looking at a whole bunch of
you
them.
are a beautiful e-waste uh, treasure trove.
Okay, yes, I didn't know that I
Yeah.
was. Okay.
Yes, you are a
So
treasure
what do I do?
trove.
So I have some old laptops. Some of them are not working. I had true story. The last laptop I had got bugs in it. It got quote literally bugs. And so I took it to the Mac store and I said, "Hey, what's going on with this? I didn't know." And they came back and told me there's bugs. I asked them, "What kind of bugs?" And the guy looks at me like, "What do you think? What store do you think you're in? We're not like a bugologist here."
Moths? Are there
So
moths in it? Are
I
there
no, I
ants
don't.
in it? What is
How do
it?
you get a bug into the little tiny crack of my computer? I no idea. But it blew my motherboard, and I was so mad. I didn't want to buy a new computer. I'm tired of buying new computers. I'm moving into this kind of computer agnostic stage in my life right now. Where I don't care. Once you get online, it's all kind of the same anyway. But then now it's sitting over here. I'm looking right at it. And then I actually have some computers back here. I don't know if you can see them. See the little white outline there? I
Yeah,
tried to
yeah,
hide it with myself,
yeah.
with my shoulder, because it doesn't fit my seat. But it's they're not working. So there were some of the ones that I got that were refurbished, but the keyboard doesn't work or something. So what do I do with them? Tell me.
You give them to Curtis.
It's a
He
good
makes
idea.
magic and makes them into working computers. And
E-waste.
yeah.
I like it.
Hmm.
There is one company I was talking to on the Big Island, Hawaii Island, and the president there, the CEO, her name is Trisha, and she donated like 30 or 40, 50 computers, old desktops, Windows 8 computers, and they had refurbished them. Uh, Somebody did it for them, and she found that it was actually cheaper for them to refurbish than to dispose of their e-waste, like in a trash or whatever. So they did it, and now we
Hmm.
have 30, 40, 50 computers up on Hawaii Island to give out to people who go to these basic computer classes. And the big thing for me is that if you are going to go through a computer class and you want
Hmm.
like one of these refurbished computers, you need one of these refurbished computers. They're
And those
so
are
perfect.
those are desktops.
They're desktops. Yeah.
Kids these days, they like desktops
Oh
because they
yeah.
can build them up.
Oh yeah.
Yeah. And so for a while, the rage was all laptops, but now they want desktops. They want
who,
fancy colors and all that.
who are you talking to that's getting all these fancy colors? I know you have some children, right? I think we
Those
talked
are my
about. I met your
sons.
son.
Okay, they're
Yeah.
they're they're kind of nerdy. They like their computer games, but they're all about. I'm like, oh, don't you want a MacBook, whatever? Oh no, mom,
Yeah.
we want this. This is a gaming computer, mom. Don't touch it.
Yeah. Okay. Are any of your boys into crypto mining?
No. Hopefully, it'll stay that way because I don't know. Tell me what you're thinking.
Oh, well, mine are. I got two boys who are deep into crypto mining. And as a matter of fact, I kind of am peripherally because I am charging them crypto, having them pay me cryptocurrency for the up use for this incredible spike in my electric bill. I think it's cost so much
Mhm.
money to run this. It's not the most green friendly type of thing, but they have some crypto rigs set up, and it's really hard to do in Hawaii. I don't know if this okay for me to talk about. I hope I don't get anybody in trouble. But it's really hard to do in Hawaii. They just went out to Best Buy. Best Buy had a GPU drop the other day, and so they slept over Wednesday night at Best Buy parking lot, along with about 160 other people, to get this new graphic processor. So
Wow.
yeah,
But I have heard it costs more to mine for cryptocurrency than it is actually worth.
no,
So,
no. That would be
no.
foolish for people to do. So think about that's just not a good business proposition. So that it is.
You said it, not me.
Hmm?
You
Say
said
that
it,
again.
not me.
Yes, no. It would
You
be
said
foolish
it.
for people to do. It would be foolish for people to do it if it costs more than you make. Then it just doesn't work. And one of the ways it doesn't work is solar. So we were talking about doing like a big giant solar farm, and I'm trying to get my kids to help me figure out the math. But we would need so many, not so much the panels, but the batteries. The batteries to run this kind of stuff is and my electronic skills, solar skills, not that good. It would just be uh, so super cost prohibitive. So at that point, you would lose money doing crypto, but they're making money. So they're making money
All
on the
right.
daily. Yeah, and a whole
All
bunch of
right.
people are. So
Well, the Kapuna are not making money
that's
on
very true.
cryptocurrency.
Look at you bringing
And
this back.
yeah, I'm bringing you back because they don't have a computer, and now we're giving them computers.
Mhm,
They need to get internet,
mhm.
and it needs to be dependable. I would say probably 70 to 100 megabytes download speed.
Yeah.
Oh, and by the way, you can test your download speed. What is it?
Mhm. Ookla.
Ookla?
Ookla.
Ookla.
Let me pull this up right now. I'm testing mine right now. Okay. I just pushed the button to start. Not that I'm flexing. Let me try see if I can bring you on here. Hang on. How do I get you on this thing? Let me get Kelley. Not me. Let's get Kelley on this. Where's Kelley? Oh, wait, hang on. Where's Kelley? Here she is. So there you are, Kelley. Now you're looking at my thing here. And look at how much look how fast my speed is. Huh? That's upload. I think. Anyway, so that is my thing. And this is like Kailua privilege. You know, I remember talking to Bert Lum one time, and I
Uh-huh.
said in the beginning when I first met Bert, like almost 2 years ago, I was saying, Bert, what's the problem here? It looks like everybody has connection. I'm looking at
Yeah.
the thing from the U.S. Census in 2016, and it looks like 91% of everybody has computers, they have internet access. What's the problem? And he goes, well, not it's not everybody, and especially in the rural areas, they don't have the kind of connection. I'm
Mhm.
like, Bert, I'm getting like 300, 400 megabits per second down. He's like, where do you live? I go, Kailua. He goes,
Yep.
uh huh.
Uh-huh.
That's what he said. And
Not
then I
that
started,
0.33.
oh my goodness. And so we're living now between Kailua and Molokai. And over there, I'm connecting my phone as a tethering device. What do you think about that? Have you had people try doing that before instead of using the hotspots?
Yes, definitely. But you try and explain that to a kapuna,
Uh,
you gotta be good.
yeah, yeah, yeah,
Um,
yeah.
or their grandkids got to be there or something,
Oh, yeah, somebody
because
like
it's
that.
hard. Although now it's getting better. Sometimes there's just a little thing on the top of your computer screen says, "Do you want to go to this?" And you say yes. So hopefully that's going to get easier, but it's confusing.
Yeah.
But that's one option.
Mm,
There's the EBB benefits.
mm,
Can you sign them up? Can you help them sign up for the EBB benefits? We want to do that for folks. Um, so once they got the computer, they got to get the internet. So that's the big challenge right now for the rural areas. And then we heard that one of the internet carriers was going bankrupt and there wasn't going to be any connectivity.
mm, mm, mm.
What are we going to do about that? Do we have
Yeah.
to put satellites up? Because
Mm,
they're
mm.
not cheap.
Yeah.
So that was crazy.
Mm,
And then they got to learn how. They got to want to, and then they got to learn how. And I think with your course, between your course, teaching them how to go on the internet, be safe on the internet, find the browser, I mean, some of them they need where's the button? Where's the on
yeah.
button?
Yes.
But I gotta
Start
say,
there.
yeah, my son asked me where an on button was on a computer the other day. So I know it's not just the kapuna.
Yes. Thank you.
Yes. I said I had to look for that on button. I
Mm-hmm,
look at it was the top left
mm-hmm,
of the computer.
mm-hmm,
Not anyway.
mm,
You got to look for the on button. Then you got to know what to do when it opens up, how to find your browser, what to put in your browser, how to be safe, because there's a lot of risks out there with the internet. So all that, and then you got to know where to go for telehealth. And so I had this idea through Hawaii State Rural Health Association, wrote a grant, and it includes some community health worker time. And they'll go out and teach kupuna they'll teach anybody how to use their computer for telehealth. They'll bring you the computer, they'll bring the hotspot if it works, sign you up for EBB if you want. But people are afraid to have people in their houses now. So
yeah.
we're kind of stuck. Yeah, you don't want just anybody to come to your. I thought it was like the cable guy coming to your house, but
Yeah.
so yeah, so now we're doing it in big groups because that's where you don't even feel safe in big groups. So we do it in groups of 9 people.
Yeah. It's a perfect
Uh,
storm. Perfect storm.
yeah,
The pandemic makes everybody have to stay home. We need to get internet connectivity, teach people how to do it. They don't know how to do it. They can't go out because they're staying home. It it's just overwhelming, I think, sometimes when you think about it. And you're doing 9 people at a time. We've been doing these classes around the state with the community colleges and the libraries. And sometimes, we're saying that we to run the class, the minimum is 3. And that is a very low minimum.
Mm,
Most
yeah.
places if you're we have to pay the instructor, so it's free for people to show up, right? It's free for them to come take the class, sign up for this, get figure out all these resources. But we want to pay the instructors, and so we went down. I remember having this conversation with Alice and Tasaka, saying, "What is our minimum?" And we both said almost at the same time, "I have a number in mind." I said, "Well, you tell me what you're thinking." And she said 3. I'm like, "Oh my goodness, yes, let's do that." And it just makes it so much more likely that the class will run. But a lot of times we've had to cancel so many classes. We've had one person or two people, and either people haven't heard about it, or people are scared to go out into a class, or people don't think they need a computer or need a computer skills. Like you mentioned it earlier, one of the big things is people having to want this. How have you addressed that for people? And I know it's not just Kupuna. We're talking about your son, the power buttons. My wife is a nurse practitioner, and she would say, "Oh, I'm not very digitally literate," and I said, "Well, I'm your tech support for life, right?" But how do you approach people with these benefits? Like, I've had people say, "I don't want a computer." I'm like, "Wait, wait, wait," and they walk away. So how do you do it? What do you
Well, actually, we just put you out there. You're the draw, and then we just tag you.
do? Nice.
Um, well, what's really nice on Molokai, they do this food drive. So they had 600 people come and get food. And then they had a mini health fair. So they would do your weight, your
Mhm,
BMI, your blood pressure, your glucose.
mhm.
And then you can sign up for your class and our class. And
Wow.
so, we're hoping Lanai's having a
Mhm,
drive-through health fair. So later this month. So we're not going to be able to do extensive training, but if they get their COVID vaccine, they got to wait 15 minutes. Hey,
all right.
do you want a computer? You want to learn how to connect? Tell me what you need. Can we talk to them while they're in that period of time? Do you want to sign up for a computer class?
Yeah.
So I think well, you hit the nail on the head with this one. Give them a computer, because how are you going to teach them about computers if they don't have a computer? It's just no good.
That's
So
exactly right. And I'm
yeah.
like, I just want to give people computers. Like some people have asked before, like, "Well, are you tracking what they do?" I'm like, "No, this is not Costco." Like, you want to check my receipt? I'm talking about you, Costco. I don't, I just want everybody to have this opportunity, right, and this access. And somebody from the American Job Center has told me a computer now for somebody in the workforce is almost like or very similar to having just those steel-toed boots, like work boots. It's just
Yeah.
you need to have it, and you don't have a hammer, you don't have a saw or whatever it is, you can't compete. You can't participate. You can't have that job.
Well,
So
for me, it used to
hopefully,
be a pen. You
yeah.
couldn't be a doctor without a pen.
Oh my
You
goodness,
got to have
those
a
are handy.
stethoscope, but you
Yeah.
can't do anything. Where's my pen? Where's my pen?
Mm.
Now it's where's my computer?
Oh yeah, those the medical health records or whatever, or I forget what those things are called. Those
Electronic health records.
that's the one. Thank you very much. Yeah, I've heard those things before. The things that you're doing are fantastic, and the reason I wanted to talk to you, one of the reasons was so I could figure out what you're doing. I know you're doing so many things, but then I remember I didn't even know this whole food drive thing was a was a was happening. Like I just showed up at I'm here to do computer class. I didn't know what's happening, and there's people giving out food. Here, Carl, take the chili plate. I took 2, and I ate both actually, for one for lunch, one for dinner. But I remember that first class, people left with a loaf of bread on top of the lunch that they had, the food drive, and then they had a dozen eggs, and they left with a laptop. What a great combination!
Yep.
Just the best thing. And you were there because I didn't have enough computers, and you're like, "Oh, I have these 2 right here," and it was perfect. It was meant to be.
Yeah. So that's none of my doing. So that I believe is a grant with, well, Rosie Davis of the Molokai or the Maui Area Health Education
Mhm,
Center program
mhm,
helped set that up with, I think Christina Higa gave them
mhm.
some money.
Ah,
Um, I think it goes further than that. I know that Judy, of course, I'm blanking because I'm on the spot, but I'll think of it in a second. So that was a combined effort, and yeah, they had like 600 people come by for food, supplies, and that's kind of the draw. And I think that's a great idea.
yeah,
You know, draw
yeah,
them
yeah,
in, and if they want
yeah.
more, if they want health screening, if they want uh, telehealth training, great. But give
Mhm.
them what they need first.
Yes, I'm hungry. And you know, Rosie is amazing. She's been putting these things together. She says, "Kyle, can you do this here? Can you do that there?" I'm like, "Sure, sure, sure." And I show up, and there's people. That's all I need. I just want people who want to learn about
Yep.
a computer and get a computer, and that's. And but Rosie is organizing all that. I think she's working with
And
Senator
then Judy
Joy. Is that right?
McCamey, Judy McCamey from the
Ah,
Hawaii State Rural Health Association, Molokai Rural Health Association. She
yes.
set up the screening. It was beautiful. They had students there. They even had a student from Kauai that was learning. I mean, it
Mm.
was just great. And oh, but we had some peripherals. We got some gifts. So we got this
What?
stuff. I got that. I got. Oh, you're gonna be jealous of this. This is a set of monitoring devices you can have in your home. Oh, let's see here. I got a stethoscope here. This is a thermometer here.
Okay.
Blood pressure cuff. Oops, I'm going the wrong way.
Okay. Yeah, it's hard to do.
Blood pressure cuff. Pulse ox.
Uh-huh.
So there, pulse ox can measure your oxygen and your pulse. There's also a glucose screener and a cholesterol screener
Mm.
down there.
Yeah.
So pretty cool. We got this donated to us, and they were using it in the clinic there.
Uh,
And then people are, if they're properly trained, they can go out into the home and use this, and you can get your healthcare provider can get information from the home.
what? I'm
Yep.
loving this. You know, I had to make a title, and I'm terrible at titles for a live stream, but I really wanted to focus on rural healthcare, mostly because of the solutions that you're doing. Not so much the challenges, but the things that you're already doing. And I want to highlight this. It's not. I was on some call or a Zoom meeting or YouTube thing or something where people were like, "Well, this first year we're going to study this, we study that, and then maybe next year we're going to hire somebody, and then the year after that, I'm like, you're killing me. What's going
Yeah, I
on?
got no patience. I
So,
need action.
so you're and I see you out in the field. This is the thing. It's not just that you don't have patience; you need action. You're doing the actions. So I'm so impressed with what you've been doing and your team that you're bringing out there. All of the materials, the handouts. I still have the booklet here on how to connect to telehealth. Hang on, just one second.
Yeah, we got to update that one.
This is
I
your
got
kind.
that one.
This is your kind of stuff. This is your thing right here. I don't know. I got this. Is that you?
That's Rosie.
That's Rosie stuff. There's all these things. I want to like do a little online YouTube class on this or something. But you're doing stuff. You're out in the field. And I always forget to tell people, like, you know, we have some viewers now who are live on this. If you have any questions for Dr. Kelley Withy, I should have been saying this from the beginning. I'm sorry, I just can't chew gum and talk and walk at the same time. But if you have any questions, just drop them into the chat on there. We're looking at these challenges, not so much the challenges, but I mean, it's the solutions. What if you had that kind of magic wand, or if I had a magic wand and I could just wave it at you and say, "I'm going to give this to you, and this is going to be some support for you." What would you want me to wave my magic wand at? What would you want for that?
Well, I want all the houses there to have good internet.
Mhm. Period.
And if that means you got to put satellites on all the roofs, and satellites don't even give you the best internet. Like I said, they gave 70 download
Yeah.
speeds.
Yeah.
Not the best.
Yeah.
But if we don't have good wired internet, if we don't have, if we can't get, uh, yeah, anyway,
So internet connection. Period.
yes,
And
yes.
I know you were talking to somebody who was there. They're from Colorado. I know I got an email from them about, but I don't know what's going on. How much does that kind of stuff cost to put a satellite connection on somebody's
Ooh,
house?
okay. $200 a month.
Oh, gotcha. So it's
Now Spectrum, I priced it out because I wanted
okay.
to know. Spectrum, what, 69 a month or something? If
Mm-hmm.
you've got your EVV benefit, you
Okay.
can get 50 off it. If you're on a
Mm-hmm.
Hawaiian Homeland, you can get 75 off it. So you could get
Okay.
Spectrum for free. But if they're on Hawaiian Homelands, I think the challenge is they're not given a choice.
Oh
You have
yeah.
to get what is offered, the
Mm-hmm.
only provider that has a contract with them. Unless that provider ran out of wire, ran
Okay.
out of cable. If they ran out of cable, didn't get your house, you're lucky because then you can
Okay.
choose.
Oh my
I,
goodness.
I don't know. This is what I heard.
Yeah.
So if you've got the other provider, how do you get a choice?
Mm-hmm.
I don't know. So that's
That.
what I would like. I would like cable to every house
Mm-hmm.
there with good
Okay.
internet speed or satellite cable. So I don't care, some kind of connectivity. And we tried out all the hotspots. And I got to say, I already badmouthed a couple companies. So T-Mobile was really nice. They said, we'll send you a hotspot. And then they call back, they email back and they go, we don't have good reception there. I'm like, okay.
Oh.
So, the hotspots aren't going to work there.
Okay.
Um,
Yeah.
yeah. So,
I don't know how to deal with this. I was almost going to buy one from AT&T, but it would cost me, I think it's $15 a month if I did some kind of over the course of some years for this hotspot, plus another $75 to add them on as another line to my current AT&T account. So right now I'm tethering everything to my phone. But I
yeah.
thought, well, if I have a little hotspot, I can have my wife's telehealth visit. We were doing telehealth. She was on Molokai up in a mountain, up Mauka, and visiting all her patients. And her patients were like, "Where are you?" She's like, "Ooh." She's like, "Are you at the beach?" And so she shows them, this is where we're at. We're legit remote, right? We're on like a off
Yep.
grid situation up there. But I was thinking about getting a hotspot, but it's $75 plus the $14 a month. I can't do that. $89 a month for not good internet. I
Yeah.
don't understand.
Well, even so, the 200 a month, you'll get download speeds of 70. It's
Mm-hmm.
not great.
Mm-hmm.
It's not great. So we do not have a good solution. And,
Mm-hmm.
this is digital inequity.
Yeah, that's a real clear divide. We are getting a final report from OmniTrack. I don't know if I mentioned that too. We're doing this statewide study. It's a sample of 900 people. It's a phone survey looking at digital literacy and digital readiness in our state. I think we're going to be the only state in the country with state level data, county level data too, for where we are in terms of our digital literacy and readiness. And so the final report's coming out. We're doing a thing in October 27th. I don't know what it is, like a DXP presentation. But I mean, a couple of things that stand out to me were like half of our state has bookmarked a website before. Like
Oh,
half, 50%. Does that sound good or bad to you?
I think that's good.
I think it sounds bad to me. I feel like that's like 600,000 people who've never used a bookmark. The other thing that was really weird was 70% had added a tab on their browser. And so this was, yeah.
Oh,
So
okay. I
then,
see what
yep.
you're saying. Only 70% have added a tab on their
Yes,
browser.
yes, yes, yes. Yeah.
Okay.
And so then, like yesterday, we did a class. Well, no, Saturday we did a class at IA Library. Fantastic library, by the way, just amazing. Uh, and we gave out computers, like 9 computers there. D-Bed was there giving out computers. Bert Lum. But as soon as we put on the browser, I'm like, hey, see that little plus right next to the active tab? Press that, and they did. I'm like, you're now in the 70%. You've opened up two
I think
tabs.
that's cheating, though. I think that's
I
cheating
know.
with your numbers.
No ways. I'm like gaming that system. So
Well,
now we're gonna.
have you talked to Kaleo Bennett? So
Yes,
this
from the
is,
Big Island.
yeah, yeah. So this is something I'm interested in is he's going to look at the download and upload speed wherever people will go. So
Mm.
I'm looking for volunteers to crowdsource wherever you go, where
Mm.
you are up in the mountains. You've got to put this in on a database that we can capture all that. So
How do we
you've
do
got your
that?
digital
Yeah.
literacy,
Mm.
study. So
Mm.
you're trying to get all what you said 900 responses. Does
We
that
got
include
900.
mine when I
Yeah.
put the test there? Yeah. Okay.
No, no,
So
no,
you're
no.
trying to
This is different. This is different. It's a little bit
okay.
different. But your test is good.
All right. So I would love it if the kids that
Mm,
are, I call them kids, but
mm,
if you got, you're going somewhere.
mm,
If you could just check your upload and download speed by checking on this website and put it in, you can say, up in the mountains on Molokai right
mm,
here at
mm,
this GPS coordinate, this is
mm.
what you got.
Okay.
You
I want
know,
to do
if it's
this.
0.33, I want to do this too. So I'm talking with him about how we can do it. He's got this great survey for folks who are in their homes, and they're going to do it, and they're gonna put
Mm.
in the numbers. But I'm like, let's do it everywhere. Let's do
Yeah.
it at the beach. Let's do it at the mountains. Let's document what is good, where you
Yeah.
get what in the state.
Yeah.
And if you got T-Mobile, that's one thing. If you got AT&T, that's another thing. You know, let's find out what different services provide. And I know they're always changing.
Yes.
They're always changing, and hopefully for the better.
Mhm.
But let's get a baseline, and then we can show progress.
Mm. I love the vision. I know Khalil Bennett from the Big Island is talking about this mapping thing, hiring some people, which I'm really happy about. But I love the idea of crowdsourcing this and like taking maybe working something out with Ookla or whatever other speed people we have, so I can just go to your website,
Mm-hmm.
kellywithyspeedtest.com, and do my thing, click on it, and access it from there, and have them take all of those coordinate things out. That's great. That's I believe you. You're somebody again that gets things done. I believe that you can make this happen.
Well,
Um,
Khalil's going to do it. He's got the website. He's got stuff. I just said, can you make a smaller survey so
mm,
people
mm,
can go wherever they are? They can just go fast. They can get
mm.
their GPS coordinates. They can get their speeds.
Oh
They
my
just put them
goodness.
in, and they're. And then I want to give them a prize. You know, let's if you got the, let's say if you got the slowest download speed somewhere, or you got the most entries, you get a new computer, you get a new phone, you get something that they really want.
I'm in.
The
I
game.
I like it. You get the slowest. Let's look for the slowest. It's like an Easter egg hunt. It's
Exactly.
like a and you got to have like fully documented, proctored or whatever it is. You have to prove that this is for real. You haven't doctored your phone. Don't game the system. And like slowed it down deliberately by opening up all
No,
these
you
extra
can just do a
tabs.
screenshot like I did.
Yeah.
I send my
If
233 everywhere.
that's right. So, I love this. The more data, the better. And to that point, I put in a link into the YouTube channel here for that digital literacy assessment that you took, and you got like 100% or something. So uh, around there, I'm pretty sure you did. Yeah, you did
I
it.
got 96 or something because so you sent it to me. Okay, I gotta
Go ahead.
be honest here. You sent me the general link and I took it
Mhm.
that way and I got a lower score. But then I wasn't paying too much attention, so then I paid attention. And so my weakness is I don't know how to personalize my computer very well. And this is
Okay.
true. I'm always asking my son, how do
Right.
I do that? How
Right.
do I do that?
Right.
Right? And so it picked up on exactly what I'm not very good at.
Wow, that's a great testimony for the accuracy
Yeah,
of it.
yeah. But the rest, it was pretty basic. It wasn't
Yep.
too
Yep.
hard
Yep.
because I'd already taken it, so I knew the trick
That's right.
questions.
That's right.
Yeah.
Good for you. Again, interesting observation that you recognize that this is my, gaps in my knowledge, and we all have them. I took one of the tests the other day. It was on a Mac. It was the Mac OS assessment, and I haven't taken it this whole time. A year I've had access to this. I haven't taken it. But why do I need to take a Mac assessment? And I missed a question. And it sounds like so arrogant. Yeah, like I missed. I know. Like, and they gave me like a 90 something. I'm like, what? And it was like forever in there. I guess I could go back in there and delete it, as an admin. I'm gonna keep it there, like I gotta keep it real. Hashtag keep it real. Dr. Kelley Withy, it's been fantastic having you on this. You have expanded my mind and with the possibilities and of the opportunities that are available, also the solutions of things that you're already doing. If anybody else has a magic wand out there that can get us some internet connection for the different islands, let's figure that out. And one last thing, the right by the in Kaunakakai, the health center. I remember I was doing some work over there, and I said, "Hey, I can't get connection on my phone." And they told me, "You got to go right outside the office to the right of like one of the coconut trees or something." I was on the wrong side, but it was true, and that is just not how it should be. You should be able to get the kind of access that you need. It's 2021. It's almost 2022,
Well, at least
and
they
we need
should
to have
put a sign up and they should say internet station right here.
right here. right on the
Mhm.
spot.
Right
Yeah,
here.
the X on this. That would be great. There's certain places that I know we're gonna lose service on our place, um, but you are doing stuff. And again, kudos, shout out to all of the things that you and your team are doing. Any last thoughts before we sign off on this?
Oh, let's see. Well, if you want to learn about oh, yes, I do have a last
You
thought. So
do.
we actually have a free telehealth system for rural folks. It's teleprimary care, telepsych. We know times are hard right now, and so Hawaii State Rural Health Association, in collaboration with UH Med School, have put this together only for rural folks. Oahu urban folks don't get this. It is hawaiiutelehealth.org. So U for university, hawaiiutelehealth.org. If you need a quick primary care visit, we don't want to take you away from your doctors or your providers, but if you got a quick question, or if you want to get into regular counseling, substance use, prevention, treatment, um, we got a lot of kids side and stuff. We want to get them connected with a psychiatrist. So it's free. You are special if you live in a rural area because it
Yes.
is free for you. So that's what I want to say. And
Oh, good.
if you need a computer or a hotspot, and I can find one that works because obviously I didn't on Molokai. Um, if you need that, we will bring it to you. We will teach you how to use that computer for telehealth because that's what we want to do. We want you to be able to get health care where you need it, when you need it.
Let me pull up this thing right now. Hang on just one second.
You
This
got
is
it
you,
there.
right? Is this it?
That's
This
it.
is
Yeah. Hawaii U Telehealth.
hawaiiutelehealth.org. I
Mm-hmm.
like it. And all the things that you can do. Okay. And is this you, the AHEC at Hawaii State? What?
Yep.
That's all your stuff, yeah. All
Yep.
right. Okay. Okay. I found it, and I put that link into the YouTube chat as well, and I like that kind of stuff. Thank you so much for all the things that you do. I mean, seriously, on behalf of like the entire state, and especially everybody, those of us living in rural areas. I'm not 100% in Kailua, so nothing against Kylo, but our heart is over on the east side of Molokai.
Yep.
So thank you so much for all the things that you're doing for the community, everybody out there who just sometimes don't even we don't even know sometimes what we don't know, and we don't know what we're missing out on. We don't know what opportunities are there, and you and your team are making that happen. So thank you very very much.
Thank you.
And so Dr. Kelley Withy had no idea what we're doing today. So I just told her, "Can you come talk about some things that you're doing?" And she's such a trooper for us. And seriously, for the whole state, behalf of the whole state, thank you so much to her and her team. Thank you for those of you who are watching this live. If you have any comments, questions, please drop them into the comments uh, in the YouTube thingy. If you're there, share this with people. Search some of the resources that are available, and then we're good to go. This is day what one of the National Digital Inclusion Week, and we have Dr. Kelley Withy on this. So thank you all very much. We are out, Dr. Dr. Withy. See you later.
Bye bye.
Bye bye. I'm going to end this. I think it is now.